We begin tonight in New Clark City in Pampanga to be used this time yet again, not for any sporting event, but as quarantine site for Filipinos who will be repatriated from China, the source of the nCoV. We have Greg Gregorio reporting live at the DOH headquarters in Manila. Greg.
Robbie, the Health Department has taken up the Bases Conversion and Development Authority, or BCDA's, offer to turn the Athletes Village at the New Clark City and Capas Tarlac into a quarantine facility. Health Secretary Francisco Duque III said its facilities are more conducive than the Mega Drug Rehab Center in Nueva Ecija. Instead of a room with only 2 beds, 1 table, and an electric fan, as was found in Fort Magsaysay, rooms in the Athletes Village are air-conditioned. It also has a television set, refrigerator, and can cater up to 3 people. But they have yet to determine the number of medical personnel who will work in the village. According to Health Secretary Francisco Duque III, the staff for the quarantine facility will come from 5 different hospitals in Region 3. Foreign Affairs Undersecretary Brigido Dulay, meanwhile, says that their team is already in Wuhan, China, processing the repatriation of our fellow Filipinos. As of now, 45 Filipinos have already expressed their wish to be repatriated. 4 of them, however, have documentation problems and may not be able to come back together with the first batch of repatriates. Those who have flu-like symptoms may also not be able or may not be allowed by the Immigration Authority to leave China, as the country is still under lockdown. Repatriation is tentatively scheduled on Saturday. But Robbie, here's the thing. The airplane that will fetch our kababayans from Wuhan, China, has not yet secured any permit from the Chinese government. But if the plan will push through, those who will be repatriated from China will arrive at the Clark International Airport on Sunday, February 9. And those who will exhibit flu-like symptoms will be immediately brought to an undisclosed hospital, while the others will be brought to the New Clark City and be treated as persons under investigation. Robbie?
Greg, did the Health Department cite other reasons for choosing the Athletes Village over the Drug Rehab Center in Nueva Ecija?
Robbie, according to Secretary Duque, the Athlete Village in the New Clark City has a strategic location, as it is isolated from community or from other people. Those who will be quarantined there will only have a controlled environment. And as to the comparison of the facilities between the New Clark City and the facilities inside the Mega Drug Rehab Center, those facilities in the New Clark City are way better than those in the Mega Drug Rehab Center. Because if we remember, this drug rehab center or the Phase 4 in particular has not been used since it was built in 2016. Robbie?
Okay, in the meantime, Greg, did the Health Department also give an update on the latest case count, at least on the number of persons under investigation?
Yes, Robbie, as of 12 noon today, Health Secretary Francisco Duque III said there are already 178 persons under investigation. 147 of them are admitted and isolated. However, 10 have refused admission and 16 are already discharged. And when it comes to the testing of the samples of these PUIs, 48 have tested negative, 3 have tested positive. Those were the previously announced positive nCoV patients. And the 127 individuals still have pending results with their samples. Robbie?
And what about the 44-year-old Chinese national who died of nCoV here in the Philippines? Do we have the latest on him?
According to Secretary Duque, the cadaver of this 44-year-old Chinese who died because of the nCoV just recently is not yet cremated, because according to the authority, there are no funerals who are accepting or accepting the order to cremate the cadaver, but they are in coordination or with a public cemetery in a place that is undisclosed for a possible burying of this cadaver. But Duque clarified that this still has to be coordinated with the Chinese embassy. Robbie?
Okay, maraming salamat, Greg. That was Greg Gregorio reporting live at the DOH headquarters in Manila. As officials are preparing for the arrival of Filipino repatriates from China, health protocols are already in place at Clark, Pampanga, where they will be landing this weekend. JC Cosico with the details.
About 12,000 passengers depart and arrive daily at the Clark International Airport in Pampanga. And this weekend, 45 Filipino repatriates from Wuhan, China will be entering this gateway, to the dismay of some travelers here.
Siguro, i-isolate. Not directly at the airport. Hindi natin maiiwasan if ever yung mga nakakasalamuha natin.
Ihigpitan na lang po siguro ng management po dito para po maihiwalay po kaagad sila kung talaga po sila ay suspected na infected po ng nCoV.
Airport officials assured that the plane carrying the repatriated Filipinos will land in an area distant from the main passenger terminal so as to avoid direct contact with other passengers.
We actually identified para mas mabilis at mas komportable din yung pag-process, yung arrival process ng ating mga dadating na kababayan. Of course, para din maiwasan yung panic.
They also no longer have to pass through regular quarantine, immigration, and customs checks. The repatriates will then be transported to New Clark City for their 14-day quarantine, while those exhibiting symptoms will be admitted in hospitals.
We have to isolate the passenger with symptoms just to prevent the spread of the infection.
However, Clark Airport authorities say these plans are still up for approval from concerned agencies, like the Health Department and the Bureau of Immigration, among others. But as of now, the Foreign Affairs Department is still waiting for Chinese authorities to give the repatriation the green light. Once they obtain the permit from China, the first batch of OFWs is expected to arrive on Sunday. For News 5, JC Cosico, we are One News.
Let's have the latest global situation on the nCoV. The World Health Organization on Wednesday stressed that there are no known effective treatments for the new coronavirus yet, shooting down any talk of breakthrough drugs. The WHO is meanwhile trying to raise $675 million for a plan to fight the virus in countries particularly at risk.
The situation can get worse. Let's use this window of opportunity to really invest in prevention, to invest in control, and prevent this virus from spreading. It's time to act, not to speculate and spread fear.
Meanwhile, doctors at a hospital in Wuhan City, China, said pregnant women infected with the virus run the risk of passing it on to their unborn children. An infected patient recently gave birth to a baby who indeed also tested positive for nCoV. In Japan, 10 more people on a quarantined cruise liner have tested positive for the virus, doubling the number of infected passengers to 20. Test results for 170 more people on board are still pending. All 3,700 people on the ship are quarantined in the vessel and barred from entering Japan. The U.S. is ramping up evacuation efforts for its citizens in Wuhan. Around 350 Americans were fetched from the Chinese city on Wednesday. They will be quarantined in military bases for 14 days.
We consider them at high risk of exposure. Medical personnel have been screening and monitoring these passengers every step of the way.
For now, the death toll from the outbreak, almost all in China, plus one each in Hong Kong and the Philippines, now stands at 565. Let's take a closer look at the latest figures on nCoV cases around the world. Chiki Vergel joins us from the newsroom. Chiki.
Robbie, what we have here is the 2019 nCoV interactive map of the Johns Hopkins University, which tracks the spread of the disease in real time. Now, over here, you can see the total confirmed cases are from mainland China, Japan, Singapore. Those are where most of the confirmed cases are. 28,085 from mainland China, 45 from Japan, and 28 from Singapore. You have single discoveries of confirmed cases over here in Nepal, Cambodia, Belgium, Spain, Finland, Sweden, and Sri Lanka. Now let's take a look at the number of deaths here, mainly in Hubei in China. You have confirmed cases 19,665, but we have a recorded 549 deaths over here in Hubei. Total recovered cases come from mainland China and also Australia, Japan, and Vietnam down here. But if we take a closer look, most of the confirmed total recovered cases are from, again, mainland China. You have 694 from Hubei. But that's on the brighter side. Now, if you remember, the MERS-CoV is actually a lot worse than this. This has lesser fatalities. Back to you, Robbie.
Thank you, Chicky.